One way, as I'm sure all of you know, is abstinence, which is not having sex at all, which is a pretty obvious way to not spread STIs. However, there are two specific types of abstinences, selective abstinence and mutual monogamy. Selective abstinence means that you communicate with the person that you're about to have sex with on whether or not they have a STI. So that way, you only have sex with people who don't have any sexually transmitted infections, so that way you're free from acquiring one. And then the other is mutual monogamy, which means you only have sex with one person, and they only have sex with you. So that limits the amount of people that could spread STI. And then, so obviously I could just sit here and scream abstinence, don't have sex at you guys. But I think it's important to know that you can still choose to be sexually active and be totally safe from all types of STIs. One way is condoms. Through our research, we kind of become condom experts. We know quite a bit about them. So there are different types of condoms, and they're all very effective in preventing STIs. Male and female condoms both are extremely, almost flawless in protecting, and obviously when they're used correctly. And then another thing that we learned about, as the video discussed, is PrEP and PEP. So PrEP is pre-exposure prophylaxis, and it's a pill that you take every day by people who have high risk. So high risk might mean you have multiple sexual partners, you share needles, or maybe you have a lot of drugs or alcohol when you have sex, which can cause you to make a poor decision and contract an STI. So by taking PrEP, you decrease the viral load in your system, making it harder for the HIV to come into your system. I should point out that PrEP and PEP is only specific to HIV, not all types of STIs, although there are multiple treatments that you can take to if you have a different STI. And then PEP is post-exposure prophylaxis, and it's also a pill that you take if you have already acquired HIV. So if you have, by taking this pill, again, your viral load will decrease, meaning that if you have a viral load low enough, you won't be able to pass on HIV. So if you have intercourse unprotected with somebody, or you give birth to a child, HIV won't be passed on to that person if you have a low enough viral load.
The only way to know if you have a sexually transmitted infection is to get yourself tested. And the most common way that STIs are diagnosed and tested for is with a urine test, which is a really easy and simple test. And it's very, it's not intrusive for the person taking the test. And you get your results back very quickly afterwards. And it's an extremely effective way to screen for many of the STIs that people commonly get. Although HIV is a little bit different because with that virus, it's a little more hidden in your body, like in your bloodstream and stuff. So for that, you either have to give a blood sample or a saliva sample. And those tests take a little bit longer to run. There's a slow one and a fast one. And the faster test, you get your results sooner, but it can't screen for the virus in as many stages in your body. But both are really effective ways to diagnose both HIV and other common STIs. And then most physicians recommend a regular physical for all people, especially if you're at a high risk for contracting an STI. And this can just help people stay aware of any possible symptoms they might have, or especially if you might have a rash or something that is a sign of some of the STIs that we talked about earlier. And it just keeps people kind of on top of their health and lets them know at a more regular basis whether or not they have an infection. So the first current event that we have for you guys is related just to Minnesota. And it was an article that discussed how every year for the past 5 years in Minnesota, there's been an increase of reported STI cases of about 20,000 per year. So that means that people are coming in to clinics or to health centers and getting diagnosed and reporting these diagnoses at much higher rates. So this may not mean that more people are contracting an STI. It could mean that there's a better access to services and people are more aware that they have them. But it is a very large number, increase per year again. And that's a very negative thing for the state very negative statistic for the state. And the worst thing about these, as the article said, is that most of the ones that people are coming in and getting diagnosed with were very preventable. Things like the person individual actions they could have taken to stop themselves from contracting this infection, like using a condom when you have sex or that kind of a thing. Although often they can be treated with antibiotics and stuff and cured quickly. The second current event is it affects everyone globally. It has to do with people who are victims of human trafficking are at a much higher risk for contracting a sexually transmitted infection because they're very vulnerable with their situations, and they often, like especially women who are part of the human trafficking cycle, are sold off as sex workers, and they are then forced to have sex with multiple partners and often are not allowed to use like safe sex measures like condoms, and that puts them at a much higher risk for contracting one of these diseases we've already discussed. And then this one's kind of weird, but there are some scientists in the Netherlands that are working on developing a robot that could replace like prostitutes and sex workers to stop the spread of STIs through that kind of a industry.
So for our survey, we got very similar, pretty similar results to the Minnesota averages in regard to substance abuse, where a lot of females said that they don't use substances. That majority of teens don't use substances when they have sex, and a majority of guys said they do a little more, and women said they don't, and we got very similar results for our survey in Eastview.
Hey Roy, how's it going? Okay, well we're communicating right now, right? Face to face. We're making sure that we're establishing trust. And that's what all these organizations are. Having trust is the first part of just making sure that the patient feels good about themselves and making sure that they're willing to get involved. So this one right here, face to face, they're more about empowering the youth and making sure that teens are getting involved. And they believe in improving the Twin Cities as well as the local communities. And some of their values that they believe in that I researched was accessibility, so making sure that teens have the ability to talk to somebody about their problems or issues with pertaining to STIs or HIVs. And just understanding like how this affects you lifelong, like what can you do, how am I going to, what medications will I need to take, for how long, etc. And then, like I said before, getting engaged. A big part of this issue is not having trust. Trust is hard to define nowadays. And making sure that you have that communication piece with people and talking about your disease is a very huge part of this issue. So the next one we're going to talk about is Clinic 555, and you'll see it on your card here today. It's low cost, and they have quality service for reproductive health, and it's offered for teens and adults. They believe that no one should be turned away for lack of funds, so meaning that if you're not the richest person in the room, you won't be denied service. They do more than just screening for STIs or HIVs. They do breast cancer screenings, pregnancy testing, gynecological exams, which is just checking for vaginal infectious diseases. It's very gross testing. Would not recommend looking up. And they do more as well.
And Clinic 555 and face-to-face, the earlier one, are actually connected, where face-to-face is more for kids or teenagers, and then when they start to get older, they send people to Clinic 555, although Clinic 555 obviously doesn't turn away high schoolers, but that's just kind of the system that they have.
And so the last one we had, we tried to get an interview with them, but they responded kind of late, like about a week later. But they still had a lot of great information to take from. Family Tree deals more with kind of like the family aspect, so kind of like how is your family going to deal with this? How can they get involved to help you to be successful? They serve over 12,000 people a year. They also hold sexual health presentations to make people feel better about their bodies and how they can change like their lives for the future while living with this disease. They have health educators standing by almost 24/7. And they want to make sure that you're able to be successful and be the best person you can be.
So the first person that we interviewed works at Clinic 555. Her name is Hillary Zander, and she's a sexual health educator.
Fun fact, she actually had an intern named Kiki when we went there, and she went to Eastview and was in this class and did this exact presentation.
I know exactly what you're talking about.
Okay, so the main purpose in this interview, we really focused on asking Hillary a bunch of questions about details and more stats about STIs that we were struggling to find with our research. And she told us a lot of really necessary information. Like she taught us about PrEP and PEP, the HIV treatment medication, and we were really surprised. None of us had ever heard of that. We didn't know that was a thing, and we didn't realize that it had been around for quite a few years now. So we think that it her job is super important, just getting the word out and spreading awareness of like those kind of treatments and knowledge about STIs.
And so our second interview was with Christine Lee, who is a great person, very experienced in this field. She has a lot of experience dealing with people who, especially teens who have been diagnosed with HIV or STIs in the early stages of their life. She told me the best way to getting rid of this disease, or just to make it less, just to diminish it, I should say, is by just making sure, like I said before, trust. So she said, quote, know who you're getting involved with and how much trust is in that relationship. So knowing, like, does my partner have an STI? Because by law, they don't have to tell you if they do, which is very scary, and that's what happens in most relationships, that people contradict these STIs and STEs. And she also said it's a very important issue today, especially in our home county. And she just had a lot of great information that you'll see in our video today as well.
So our third interview was at Face to Face with John Lutz. He's a very passionate about his job, fun guy. His beard was way bigger when we met him, really low. It covered his whole neck. But so the main takeaway that we had with John was that when he discussed preventing the spread, is that it said it was a change of mindset. Now obviously you can't force a change of mindset, but what he was trying to say was we treat people sometimes who have STI like chlamydia or herpes as kind of like almost like stay away from them, like that's kind of like gross or something, and that we don't treat them as we would with someone else who just has a regular sickness like the flu. And he said if we have a change of mindset and think about someone who has an STI as just if they were just sick, then we could help them. People wouldn't feel as self-conscious if they had an STI, so they'd be more open to getting treatment, more open to allow people to help them. So this would prevent the spread of STI because people would be more aware of any sexually transmitted infection that they had, and they would be more open to getting help for it. And this is Click 555. This is a condom wall where they had a whole wall of boxes of condoms. Like we've seen a lot of condoms.
So going off of what Michael said about changing the mindset, the most important thing you guys can do to help with that movement is by studying the conversation and educating yourself. So that means going out and seeking knowledge about STIs to make sure that you're knowledgeable, and then studying the conversation with your sexual partners, your friends, even your parents, to make sure that everyone you know is knowledgeable to help prevent the spread.
Okay, so here are some apps that we found that are helpful in preventing the spread of STIs. The first one is called Bedsider. It was recommended by Hillary Zander, our first interview at Clinic 555. It's actually more focused on contraception, but it can also be used to help with STI prevention. So you just answer a few questions about what is your preferred method of contraception or STI prevention, and it gives you a little daily reminder just to take your birth control pill or take your PrEP pill. And it kind of does it in a weird way. Like this one is an example talking about goat yoga. It says go do goat yoga after you take your pill. And then the second one is the STD calculator. You just answer a few simple questions about your lifestyle, and it runs through calculations and tells you how much of a risk you're at for contracting an STI. The third one is the Center for Disease Control's STD Guide app, and it has a complete list of all the possible STIs someone could contract. And then when you click on them, it gives you more detailed information, and it suggests steps you can take for treatment or people you can call if you think you might have this STI.
Okay, so everyone on their table has a note card. So look at it and see if there's any writing on it. And then everyone needs to get out a pencil. And in a moment, we're all going to stand up, and you're going to shake hands with 3 people that are each from a different table, and then have them write their name on your card. No, don't write your name. I mean, you can write your name on your card, but you don't need to.
Yep, go ahead. And then when you're done, just sit back down.
Oh.